ഹലോ, നിതീഷ് ചേട്ടാ. ഹലോ, 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 ഹലോ.
ഹലോ.
ചേട്ടാ കേൾക്കാനുണ്ടോ?
സൗണ്ട് കുറച്ച് കുറവാണ്, ലാപ്ടോപ്പിന് കുറവായിരിക്കും. കേൾക്കുന്നുണ്ട്.
ഓക്കെ ഓക്കെ,
ഹലോ,
ഇപ്പൊ ശരിക്കും
കേൾക്കുന്നുണ്ട്
കേൾക്കാം.
കേൾക്കുന്നുണ്ട്.
ശരി ശരി ശരി.
ഹലോ, കേൾക്കണില്ലേ?
ഓക്കെ ചേട്ടാ.
ഹലോ, കേൾക്കണില്ലേ? കേൾക്കുന്നുണ്ട് കേൾക്കുന്നുണ്ട്. ഹലോ.
லாஸ்ட் டைம் பிளாட்ஃபார்ம் செஞ்சோம்.
Another filter which is
We welcome, sir. I think Dr. Jawahar sir has joined.
Yeah. Hello.
Sir?
Can I audible?
Yes, sir. Yes, sir. You're audible.
Oh, tell me.
Can we begin, sir?
Yeah.
Okay. Good afternoon, one and all. I take it as a privileged opportunity to welcome one of the eminent practitioners in our region, Dr. S. Jawahar. Sir is an alumnus of ANSS Homeopathic Medical College, Kottayam, and is a practitioner of a great system since 1991. He has chaired as the past president of Tamil Nadu Homeopathic Medical Association of Erode chapter, vice president of Predictive Homeopathy Tamil Nadu chapter, and in his teaching career, he has been a guest lecturer in Martin Homeopathic Medical College in the Department of Organon. Sir is presently the head of the department, Organon, in Hahnemann Homeopathic Medical College. So we truly value your presence here and much await this one precious hour that would help us to be better practitioners of this boundless system. We welcome you, sir.
Oh, thank you for. Am I audible and am I?
Yes, sir. You're audible, but your video is not.
One second. One second, please.
Yes, sir. Yes.
Hello. That video I'm searching something on 1 second. 1 second, sir.
Recording in progress.
Can you see me? Hello.
Sir?
Can you see me?
No, sir.
I'm seeing everything.
Is there anybody who can view, sir?
Actually, sir,
Everything fine.
actually, two accounts are there, and both accounts mic is on, so it is actually looping.
Okay.
From both accounts, the mic is on. So it's like,
Sir, now we can see you, sir.
Okay. Can you hear me now?
Yes, sir. Yes, sir.
Can you see me now?
Yes, sir.
Okay. Let me start. Good afternoon, everyone.
Good afternoon, sir.
I don't know how you will understand these things and all, because from here I am teaching you and I don't know your expression. I don't get your expression properly. Wait. Let me start with the case. Before starting, we have to respect this great man, whom only I am standing here, and we are together because of him only. Let me have a 1 second prayer also. And again, this is for my guru, guide, mentor, all teacher, everything. Dr. Prafullu Jaikar is from Mumbai. Whether you are seeing my slides?
No, sir.
No.
No.
Now,
Yes, sir. Now it's visible.
what I learned from Guru is like this only. Same thing I want to teach you. Just I'm giving a fishing how to take the fish. I don't want to give how to cook the fish and all. I'm giving only how to cook the fish. I don't want to give the fish directly itself. My guru, Dr. Praful Vijayakar used to say, all the things in the universe are created by miasams only. He used to taught us only miasam, everything on behalf of miasams only. Everything. For example, if he is coming late to the clinic means. Hello. Hello. Can you hear me?
Yes, sir.
Yes, sir.
It's audible, but it's because of echoing, it's not much clear.
Huh? I didn't hear you.
Voice is echoing, sir.
I don't know.
Sir, I think 2 accounts have been joined from your name, sir. So if we can remove one, then I think it will be louder.
Now also it's coming. Hello.
Oh, now it seems clear, sir.
ஏய் தமிழ் நீ உன்னதான்டா
Can you see me now?
No, sir.
What happened to this video?
The voice is clear, sir.
1 second. I don't know what happened. Can you see the slides?
Yes, sir. And the voice is also seems to be clear now.
Voice is clear, no?
Yeah, better, sir.
Okay. Let me. I don't know what happened to the camera. It's not working. I don't know how it worked, and now how it is not working. I don't know. Let me tell the cases and all. You can see the slides, no?
Yes.
Okay.
Yes, sir. It is visible and the voice is clear. Dr. Vijayakar sir used to tell everything on behalf of miasams only. Each and everything, even in traffic jam, when he's coming late means he used to tell today civil tech traffic jam happened, means that someone died, so traffic jam, or soric means that my tire got punctured, so soric traffic jam. Like and all, he used to differentiate everything in miasams only. Hello. I'll show a case, then I'll continue with my lecture. This is not a case. It's a case of hydrocephalus baby in uterus. That is, they came to me at the 6th month of pregnancy. Their allopathy doctors told them that to get aborted because of hydrocephalus. Why this pregnant woman, 7th month they came to me. Why this baby got hydrocephalus during pregnancy? Actually, they saw through scans only. In allopathy, there is not only in allopathy, Ayurveda, Siddha, there is no ailments from except homeopathy. You have in homeopathy only we are only the system having ailments from. If you go and see pathophysiology book or a practice of medicine book, most of the ailments will be unknown, in unknown character only. It used to written in unknown ailments, unknown everything. You take cirrhosis of liver, they'll put only alcoholic and all. But in homeopathy only, the each and every disease we are having, each and every disease we are having ailments from. For example, that ailments from, I think you might heard about Dr. Hammer, German physician. He only taught us a lot of conflict for each and every disease, and that disease we can take into our that disease we can convert into our rubric form, and we can take him for our repertory purpose. That is the ailments from for each and every disease. It is there. Dr. Hammer, you can check in the website, Learning GNM A to Z. One website is there. You can go and see for each for all disease they placed that Dr. Hammer written each for all disease ailments from. That we can convert for our benefit of homeopathy. We can convert as a rubric. Here, this hydrocephalus baby. Why this baby got hydrocephalus? Hydrocephalus means the during the time of pregnancy, we used to differentiate pregnancy in two parts. One part is first to 5th month, second part is 6 to 9 months. That first 5 months of the pregnancy, 100% more structures will come. Second 5 months of pregnancy, functions will come. So most of the mostly the first 5 months of the baby is some outline of the structures will be there in mother's womb. When this hydrocephalus baby got when this baby's mother got pregnant, that time there was a conflict between there was a fight between mother and father. I'll show that. This is our second delivery, consanguineous marriage. First child was a cesarean baby. Mostly in consanguineous, I don't know I don't know this theory, but someone told that mostly in consanguineous marriage, second child used to get most of the genetic genetic disorders. This is the thing. This is the first scan. You check the date, 21/10/2011. Both lateral you can see the both lateral ventricles appears prominent, measuring 8.8 8.8 into 9 centimeter, 9.4 centimeter. Cerebral lateral ventricles appears prominent. Fetal cranium shows prominent ventricle, that 8.4 centimeter. This what this the thing happened, and they told the mother to get aborted, and she came to us. I told anyway you are going to deliver this baby normally, and then only you are going to kill the baby. So give me some time. So I gave one medicine. After hearing the history of the mother, I gave one medicine. I'll tell the story. I'll tell the story. Actually, this is the story which appeared in the screen. She's from Orthodox family. After marriage, she was tortured by her in-laws, but she didn't express this emotions or angers to anyone. When she was conceived for the second time, her husband resigned from the job for silly reasons. This happened the first month of pregnancy. Please note the date, the time of this thing. She was worried, got anxiety about the future, very much depressed. She told that my sisters are in a very high position. I don't know how I am going to face them. This was the thing she used to tell repeatedly to she used to tell to everyone, even to me also. She used to tell like this. She told me that when I'm pregnant, when I got pregnancy positive, that time this man came and told me that I resigned my job. That in Tamil they used to tell "Talaile idi vilunda mari irukkunnu." So like that, there's something, some heavy stone. I feel that some heavy stone he put on my head. Like that, the same word she told me. So I am everything in homeopathy or in anything that in our system or health system, everything is mathematics. So when she got this shock news, she herself told that something he put on my head. There's some stone he put on my head. So that what happened to the child. This she passed to the child. This message she passed to the child that this girl your dad lost the job, and he put the stone on me like that, and this that 1 second, I'll show that. Why she got the hydrograph? This is the thing. In 30 days, the bones of the wallet of the skull used to join together in 30th day. But this child, this mother got this shocking incident, so that normal growth, normal closing is not happened, and now the head became hydrocephalus. Actually, the rubric taken was only 2 rubric I took out of this, because it is an emergency situation. I didn't go to the full cases and all. Ailments from excitement, emotional suppression, and a despair of social position. She what she told that before in a case history, she told my sisters are in good position. This fellow resigned, and we will definitely will be in a low position only, like that and all. These two only recurrently she passed it into her mind, and that passed to the child. In this, the suppressed anger and the suppressed emotions will covered by one drug. Patient is chilly. I gave Staphysaccharide 200, only 1 dose. Believe it or not, only 1 dose. Those who are with me, they used to tell me that they used to see those who are coming to my clinic. They used to know that I used to give only one dose only. Another one thing is there. After our Staphysaccharide, one beauty happened to this kid. Previously, this kid was in breech position. After our Staphysaccharide, the position also turned. It came to cephalic presentation. If you know, if you see, this means, and the size of the lateral ventricles reduced. Everything that cephalic presentation unstable came in the scan report. I don't know whether it is clear or not. Lateral ventricles size size reduced. It came to the normal range. Presentation cephalic 21. Head circumference normal, complete cephalic presentation. And this is the boy. They sent this photo after 10 years. Actually, this boy, they about to get aborted, about to kill this boy, we can say. By God's grace, everything became normal, and now they are settled in USA. This is another one. Why I am showing these cases and all means this case. What are the cases I am showing? All in my clinic, mostly in single drug only. As a student, as a practitioner, in future, if you're going to start the clinic, definitely you will get these types of cases, and definitely you will get some ideas how to handle these cases. This according to my small experience, I'm telling about these cases. I'm not showing that I'm the only thing or only fellow that who can handle these cases and all. Just I'm telling you, you also can handle. Anyone can handle these cases and all. This is a case of actually hepatic coma. This is the second visit. First visit I saw her in the ambulance only. I saw they told that this is also in a hopeless case. Just go and take her to your house and make her a last breath in the house itself. And she came to my clinic in the ambulance only. I just went and I saw. I didn't get much more detail and all. I gave one medicine and I asked, because everything surrounded by that oxygen tube, Riles tube, everything was there. So I asked her daughter to apply this medicine around the lips. I asked her daughter only application, nothing else. After application, this is in the 3 days she got up and they sent the photos to me. See, actually, in the first that I missed somewhere else, in the first report, it was nearly 30 something the total bilirubin level. SGOT, SGPT, everything in the higher ratios only. The first report, it was 30 something. After 3 to 4 days, they took and they sent to me. This was 17. It reduced to 17 in 4 to 5 days itself. Again, the follow-up, it came to 9.73. Second follow-up. Again, 4.13. In the meantime, SGOT, SGPT, everything. This is her. This thing. She came to my clinic like this. And lastly, it was a 2.87 bilirubin level. Hemoglobin also raised. Previously, it was 7 only. This is, I think, this one symptom only I got: unconscious coma, jaw dropping. This was the only symptom I got from by seeing her. Given medicine was lycopodium, because it's a hepatic coma. Then sulfur or opium, lyco will act very fastly. And that too, I applied. I asked them to apply every 10 minutes once lycopodium 200. One dose. The means on dose means in the liquid form I gave, and I asked them to apply. This is her last visit, and I told her not to come now. I think this somewhere around 2016 and 17, she came the last visit, and she was normal. Now she is still she is alive. It's a case of hypothyroidism with the profuse menses. Mostly these kind of cases we used to get a lot in our clinic. This kind of psychotic cases we used to get a lot in our clinic. Here, see the hemoglobin level and the TSH, anti-TPO, everything. This also a case of this particular lady. She used to have a peculiar type of character. Nobody in the neighbors won't like her behavior and all. Most of the mostly they used to mostly most of the I am due to lack of time I didn't type fully. Mostly they were neighbors avoid her. Neighbors used to avoid her. These are the rubrics I took from her. There's this hypothyroidism of the profuse muscles with headache. These are the things I gave her. Ailments from the same excitement, emotion, aversion to all persons. She was actually she was not liked by anyone, but she used to tell, I don't like anyone, I don't like anyone. Actually it is more like this aversion to persons like that and all. So and during head pain, there is another one thing is that she will have excessive hemorrhage, that is excessive menses flow, heavy flow during the headache. So that time I gave, China is one of the bleeder, so I gave China 200 a single dose only single dose. I think after 6 to 8 months this report came. The thyroid level is slowly getting normal, and after 1 year TSH become the same shanti, TSH become 3.1 and anti-TPO become normal. In most of the thyroid cases, whenever you are treating a thyroid case, please check anti-TPO always, because this anti-TPO is an autoimmune nature of a patient, that you have to definitely check the patient and you have to treat accordingly. If you are seeing only T3 T4 TSH level, means whenever you are treating, it will go thyroid, you will cure the thyroid, but definitely one day thyroid will relapse again, unless this anti-TPO must be reduced with our medicines. There is no proper medicine in allopathy to cure anti-TPO levels. This is another case. It fetched a lot of names. This actually, we are conducting a Thursday clinical meeting in our place, Erode. This case came there, an hypoplastic uterus. One thing, most of the cases which I am showing, I didn't get the permission of the patient. If you are recording, no problem, but please don't share to anyone, because if I'm showing the photos and all, if the patient gets if the patient knows, means it will be bad for me. But you can record and everything, you can share to your small group, but don't share to anywhere. This like this, because hypoplastic uterus, because this girl might get married, and I don't know whether she's married in this time or not, but it may affect her futures also. Please look after that.
Okay, sir. Okay.
If you see the scanned report, it's a uterus and ovarian morphology not demonstrated, likely aplastic or rudimentary uterus. There is no uterus and all. The uterus, see this scan report, uterine morphology structure could not be demonstrated, ovary is not demonstrated. It's a girl. I'll tell the story. It's a long story. I'll tell in short. Actually, this girl was when during this is also I'm telling about the mothers. Actually, this girl, her age is 16, and when she's not getting her menarche, their mother and their parents went and saw. They at that time they found that it's a aplastic uterus. But this aplastic uterus, how it came, whether whether it will be there suddenly. No, from the birth itself. So when we are purchasing a car, so if you go and see and suddenly that steering wheel or brake rod is not there, whose mistake? It is manufacturer's mistake. Like that, whenever if you are seeing the genetic mutation cases like this, you have to ask the mother's pregnancy history. That is 100% important. If the mother's pregnancy, if you get the mother's pregnancy history during the time of the either it is first 5 months or second 5 months. I told no, first 5 months structure, second 5 months functions. In this case also, first this is that uterus is not not grown, so it will be definitely in the first 5 months itself. So here the beautiful thing is, mother always think about this girl's mother all before pregnancy. This is the second child. First also girl baby. Mother always think about male baby only. She want badly need of male baby. First is a female baby. Second, she want bad of female baby only. Sorry, male baby only. So she put lot of prayers in front of her. She pasted a lot of posters of a male baby. She won't. She won't. That mother. She won't even see a advertisement in the TV also. As if any female child is coming, she used to avoid and she used to close the TV. Such a violent delirious condition she went during pregnancy, and the child came was a female. She came at the 18 years of the thing. Child came was a female baby in a male female baby in a male hormones. Everything, testosterone high, FSH low, and everything got abnormal. But she's a female in a male with a male hormone. If you see her, actually this photo I took after when she attained the menarche. But before that, she used to be in a male character only. She used to sit like a male. She used to sit like a boy, and when she's riding a scooter, she used to put the legs like a male, like and all. So the thing, I gave the medicine, which medicine which have a tendency to grow grow something also, to grow the uterus also. Here, what we can take. If I am taking the class directly, I can see your faces and all. Now I am talking with the inanimate this thing. See, mother expect a boy child because first child also girl. So whole months of pregnancy, she thought about a boy only. So from there itself confusion starts. These are the two rubric I took for identity, because what is identity? Identity is a male or female thing. Here a mother got confusion about the identity. If I get the female baby, what will happen? If I get the whether I will get the male baby or not? Like that confusion from before conceiving itself, she started. Then second rubric is in generalities. You can go and see growth affected, because there is no growth. Growth affected means either part or either organ, anything. So these two rubrics are affected, and actually she was a lean girl. After our medicine, after that menarche, she put on some weight. I gave Calcarea fast 201, single dose only, nothing else, single dose only. After 4 months of the Calcarea fast, there was a thin hypoic structure noted in the posterior to bladder, likely a hypoplastic uterus. Previously, it was aplastic uterus. Now it became hypoplastic uterus. Then after that, there was thin hypoechoic structure seen in the posterior and measuring 3.4 into 0.7 centimeter. In this time, she got the menses. This time, and the ovary also, ovary structure also grown. In this time she got the menses, and now she's still coming. Her FSH, LH, prolactin level, everything become normal. We convert her from a male to female. Her testosterone level came down. All other blood parameters became normal. Now also she's coming. Sorry, now not. I think past 3 years back. Lastly, I saw. She told that I'm getting regular periods and all. I told her one time to take the scan and send to me, but still no, she didn't. That was my what I showed was the last scan with me. Otherwise, she didn't. After that, she didn't turn up. But I heard that she is getting regular menses. Total 5 doses. This thing. Sorry. Altogether, right? This is another case. A case of epidermolysis pemphigus. It is also a genetic mutational case. This is a girl. See the skin. Here, the one layer of skin itself absent. According to GNM, what is skin? Skin means external covering. Okay, external covering. Who covers us? Our parents or our senior family members. They cover us. In this case, what happened? What happened when there is no layer of skin, or the skin, this ulcers are like this. Actually, she have no nails also. That photo is missing. No nails also. So there was a severe conflict between the parents. So this girl got this epidermolysis pemphigus from the birth itself. The skin. Another one story is this girl's mother was a mother was a teacher, and her father actually he went to some job during the marriage. After that, the father got some sick and he resigned the job. After that, he didn't go for the job. When the only earning member is this patient's mother. During pregnancy, this mother thought that whether we need this baby, whether we need she wants to. This baby is unwanted baby, and she wants to abort this baby. This abortion thought process frequently used to come to her mind. Let me kill this baby. Let me kill this baby, like that and all. Because that father, this girl's father and their brothers all are unemployed. Earning member, her mother only. Her mother totally went on despair condition that why she got like life like this and all. So she thought to kill this baby always. But after delivery, she got the baby like this. And they came actually recently only. And I didn't get marked mother's history during pregnancy and all. And she got these symptoms she used to get: highly itching with the bleeding tendency, that skin everywhere, when even small boil, it used to bleed. Along with this itching, she got a violent itching in the genitals until it bleeds. This is another one peculiar symptom, violent itching in genitals. She used to take knife and itch her vaginal area with the knife because such a itching, intolerable itching. And these are the observation points that you also have to note whenever the patient enters the cabin itself, the case taking starts. So her constitution, her facial appearance, facial expression, her physiognomy of the face, everything. Here, these things I noticed: thick, big lips, unhealthy skin, bleeding skin, wrinkled skin. And these are the wrinkle even it is in repertory that wrinkled skin. We are having a lot of medicines. Following rubrics I took: female genital itching, violent until it bleeds, skin ulcers bleeding, ulcers warmth aggravation. In unhealthy, every scratch heals with the difficulty, skin wrinkled. These are the rubrics which I took. These are the things that came. Skin ulcers, these are the rubrics. And cecal core and lycopodium almost covered everywhere. Cecal core and lycopodium. Here, another one thing, she used to get a peculiar dream, constant dream about blood. Honeyman told this thing in one footnote about dream. Whether you know, if I don't know whether my question reached you. Honeyman told this about that you have to consider dream as an important point in one footnote. It's a footnote number 10. You can check it. Go and read, and you can check it. Footnote: warning dreams and superstitious fancy. This footnote I am not reading fully. This footnote number 10 is very important in the homeopathic point of view because it gives a lot of clues. Because dreams are actually it is not voluntary, or all are coming involuntary. So this involuntariness of the dream is must for us to treat a case, and because it is a highly syphilitic tendency. If a patient getting dreams of clairvoyance, means those who are getting dreams of that whatever they are getting, that tomorrow whatever going to happen they will get today itself. That is dreams of clairvoyance, dreams of snakes, dreams of animals, dreams of river, dreams of water. These are all syphilitic dreams. You have to, whenever you're studying repertory, please study according to miasms. Then you will it will be easy for you to read, easy for you to differentiate everything. Even if dreams of money, dreams of accumulation, dreams of property, these are all psychotic rubrics. Dreams of daily routine life is soric rubric. Like this, you have to differentiate the dreams, and according to the miasm. And according to the intensity of the case, you can take these rubrics as a eliminating thing. After our medicine, slowly it healed, but the wrinkleness are from the birth, so we cannot change that. She became like this. After our medicine, cecal core 200, only one dose I gave. Our medicine stopped our medicine stopped the recurrence of that ulcer, and itching, and that vaginal area, everything gone. Now the patient 100% she's active, and she got married. Now she's working as a professor in a college in Chennai. This is a case of atopic dermatitis of a kid. Whether you are seeing the rashes of the kid, able to see the rash?
Yes, sir.
Yes.
Yes, sir.
On this thing, these are by seeing the rash itself, what emotions that kid underwent. Whether you can say, able to say, by seeing.
Angry.
Yes, 100%. Good, very nice. Angry to whom? See this thing. This is also a small story I'll tell. I'll explain it then showing this. Only symptom I got was the why she got this means during during the mother feed time, when this kid is drinking milk with the mother, this kid's grandma, that is mother's mother-in-law, asked about dowry problem. Asked about dowry problem to the mother. And the mother got angered. I'm giving milk. This lady is coming and asking me about this dowry after 3 years of our marriage life and all like this. She thought and she got angered and she didn't express the anger itself. After within 10 minutes, this kid got like this. And here, if, I don't get much. Actually, that time I was somewhat busy and I didn't get much time to ask full history. Only symptom I got was child cries after urination. Here, the observing point is cries during urination means whenever a child cries cries after urination means you have to think whether the child got really some urinary infection or it want to change the dress because due to wet it will some children will not sleep in the wet itself. Some children will sleep like alumina, beretta. They will sleep in the wet. They will not even sulfur also. They will adjust themselves in the wet thing. But during but this child whenever this child is passing urination, immediately they have to change the dress. Otherwise, the child will cry a lot and it will not sleep also. Redness means anger. This one just I told. And after seeing that, I gave a medicine. 7 days after our treatment. Only 7 days. Can you guess the remedy? Arsenic iodine. Huh? Hello. Arsenic iodine 0/1 dose because mostly I used to give this 50 millisiemen to kids and skin eczema, skin eruptions, psoriasis like and all, to avoid aggravation, unwanted aggravation. Only 1 dose I gave and the child became totally normal. All rashes gone. Actually, a lot of cases are there in different pathology, but to show you means I have to show only skin cases and all, because otherwise it is like an evidence. For example, cirrhosis of liver, this thing, ascites, CA cases and all there, but that we cannot able to show the full result and all. Skin means it is an evident we can think it's an evidence based practice. So I'm showing a lot of skin cases. I'm showing these cases and all because to you for you to use repertory in a different way. This is a case of a boy. They actually is in the US. This boy is having this full of eczematous eruption in the face. Because and this is another story is this fellow is a swimming champion. During the time of swimming competition, he got, actually the day before the swimming competition, he phoned to everyone in India's relatives to see this competition in YouTube. They are making live arrangement in YouTube like that. And what he done know, during the day of swimming competition, he got severe fever, but he didn't tell to his parents, and he went to the school and went to the competition. At the time of competition, the referee saw him that he is trembling, his body shaking, and the referee saw that the time temperature was 105 something, and it disqualified him from the. So he came to the house and he cried a lot, and he told how I will face the thing. I told everyone that to see, but I am not here. I am, but the referee didn't allow me, and everything gone. How I will show my face and all like that. He cried like that, and after that, within 2 to 3 days, I think this eruption came to the face, only in face. And I took simple rubric only. This is fancy deprived. Which drug it will be there? Only one medicine. Only one medicine is there. Tarantula hispanica. 200 single dose I gave. This also in 20 days something, completely gone. This is a diabetic gangrene. This I'll tell you. I think you all will be in a holiday mode from tomorrow onwards. Everything is all day, so I'm not taking much time. It's a case of eczema. Eczema. Two months after our medicine. Slowly. Actually, this thing I'm not having time to type a full case and all. Just I'm showing out how I arrived the drug and all. 6 months after our medicine. This eczema patient, actually I saw this case and I didn't take much history and all. Only thing, this patient is a highly intellectual person. He can write poems and all, everything. And he is very much intelligent in only one work. He is doing some printing press something. He is master in that, but he don't know even how to operate latest form of cell phone and all. He don't know how to operate he don't know how to operate this small thing also. He is having this old phone only. Everything, even to get a milk, he won't go. His wife only used to go. So these two verses makes and this routinist. Only these two thing. I didn't go for repetition chart and all. For your purpose, this thing I took intellectual eruption eczematous. Postponed everything to next day. Here it came was actually I gave Beretta sulf only, because Beretta car covered these things. And this is sulfur. Actually it's gone. Sulfur that versus makes and all. So I gave Beretta sulf only because of his. If you see, means it will be, his face, everything will be idiotic only. But he is master in that one printing press and all. And in that time, free time, he used to write small poems and all, small stories and all. So I gave Beretta sulf 200 only on those. Beretta sulf 200 completely, he got completely cured with this. Beretta sulf cured in I think 4 to 6 months. This patient's daughter is a homeopathy doctor. She only took him to me. This is another one beautiful case. alopecia universalis. Not even a single hair in anywhere in the body. If you see this eyebrows, eyelashes, head and all, this thing, even axillary hair, pubic hair, not even a single hair in her whole body. How it came means I will tell the story also. She is a MSc, MPhil, MEd teacher. Her husband is an auto driver. Actually, her husband cheated their family that the husband is working in a bank, and they told he convinced the family, and he got married with this lady. When she went to the house only, she saw that he is an auto driver, and that house was that line house having a common toilet. Now this lady's sister's husband was an allopathy doctor. They are so much rich, and this husband cold-bloodedly cheated her, and she doesn't want to show her face to anyone. She lost her identity, total identity she lost because of her husband. And she never came out after that. She never goes to any of her relations' house because of these things only. After our medicine, this is after 6 to 8 months after our medicine. This is her. After our medicine, I think this also 3 to 4 doses. This is the rubric I took. Confusion of mind, identity. She lost her identity. Hair affection, alopecia, falling out alopecia, delusion, body. After that, head belongs to another. After that, what is the meaning of this rubric? This rubric meaning is that her brain is not her own brain. Her brain is some other's brain. She always means even for small things, her husband or her daughter only they will only do all work. She will not do any work. Like that it happens. So that grief and everything I gave natrum mute 200, mostly 6 to 7 doses only. That everything on the basis of grief, the patient won't show any emotions in front of others. Not even showed her emotions to her mother. She won't weep in front of others also. There is one rubric also there. Though her husband used to scold in front of others, she won't cry except water used to load in her eyes. Another rubric we can think this time was weeping cannot weep through though sad. This is another one rubric. It also Natramur covered this. Natramur cover is in that rubric. So I gave Natramur 200. And this is the thing. Actually, the if you see means it was this lady sent me this to this WhatsApp message. I just took it as a for a screenshot to show you. Now only I also send these photos to Dr. Sivanandan, my sister husband in Pollachi. He called it a medical miracle. It is not. It is actually homeopathy miracle only. Within 6 to 7 this Sivanandan, I think he's somewhat dermatologist. I don't know exactly, but they put nearly 40 to 50 steroids in her head only. Not even a single medicine helped her. Not even a single medicine helped her. Our ordinary natrum mute 205 to 6 doses completely cured her. Everywhere that has came everywhere. This is another one interesting case. Keratocystic odontogenic tumor. This also I didn't took much. Actually, this is my friend's case. He sent me this photos, and can you see the photo?
Yes, sir.
This tumor size, cystic tumor, the bottom part. After our medicine. This is after our medicine. Actually, he sent me this thing. What I can say. He sent me the photos only, and he told me that she's also having some fissure, severe fissure and fissure problem, and this thing. What I can say, that severe fissure and bleeding rectum. So I tried with nitric acid and all, but it didn't help there. After that, only after again went to the pathology. I saw one of my mentor, Dr. Manusar. He told me to you think about the pathology. So I think about the pathology. It was ordered. It is nearly about gums. So acid made when I gave nitric acid, it worked partially and it helped that patients. It helped partially and it helped that the patient's rectal bleeding and all. But this tumor size not reduced. After that, when I'm thinking about that acid which is acting in gums, which one it may be? Any idea? Acid which is acting on gums. Fluoric acid. So that my mentor, Dr. Manusar, gave an idea about this, and this fluoric acid given. Slowly, it automatically this is the thing. Now she's completely cured. That too in very small period only. 7/1/2002 and 14/2. In 1 month, completely gone. Fluoric acid one or two doses like that. That's all. I think time is up. There are some more cases and all, but I am not showing fully. This is the thing. Homeopathy is a holistic science. It must be practiced with utmost sincerity and in orthodox way. Limits of homeopathy is homeopath himself. This is my gurus, Dr. Prafullo Jekasar, always used to say. Limit is ours only. Previously, before coming to predictive homeopathy, when I am doing some mixopathy and all, I used to fear how to handle this pathological cases and all. After coming to predictive only, after seeing Dr. Jekasar's cases and all, I also started to treat CA cases, renal failure cases and all, and some deep pathological cases and all. By God's grace and my Guru's grace, it's my journey is going on. I think I am concluding my lecture here. Thank you for your patience hearing. If at all any doubt, please send me SMS SMS to me. Because I'm not able to see you all, and I don't know how these things, how many of you got these things and all. So can you hear me?
Yes, sir. Just
thank you for your patience hearing. If at all any doubt, you can ask me.
Sir, I have two doubts actually. Sir, you told about that particular case where
no, I'm not hearing you properly, please.
Hypoplastic uterus.
Yeah, hypoplastic uterus, yes.
Sir, hypoplastic uterus. In that case, when there was changes pathologically, but did you find any changes in character-wise after our medication?
Yeah. So only I told you, no. This
like
is after giving our medicine, she became timid. This is the photo. 1 second.
Good afternoon, sir.
Good afternoon. Gokul, good afternoon.
Sir, your experience with the keloid cases, sir? Any keloid?
Actually, 5 to 6 cases only. Cured cases are there, but actually, we are if we are giving a 1 second. This is the thing. The sitting nature became changed after our medicine. Actually, she was sitting like a. She used to sit like a boyish character. After our medicine, she became timid.
Okay, sir.
And regarding keloid, actually, the cured case which I am having means I took complete case history, physical general, mental general, and I gave. It is not working in Tuja, anti-crude or Ruta something. But after taking full case taking only, I am giving.
Okay, sir.
We are getting results, but it used to take time. Nearly 1 year, 1.5 years, it is taking time. But in keloid, we must not change the drugs frequently. Whenever they are physical general or something mental general, if they are getting better, then we can give only placebos. It only SL. It is enough.
Okay, thank you, sir.
Any other doubt, please? Actually, a lot of cases are there, but due to lack of time, today actually I thought there is no class. So I start to see the patients. Suddenly they called, and cases I cannot able to type. So I am very poor in type, lazy in typing. Any other question? Tell me.
No, sir. I just wanted to know if anybody has any doubts.
Recording in progress.
Sir, shall we conclude, sir?
Yeah.
Sir, thank you for such an enlightening session. You are one of the persons we look up to who have showed us the way how to practice homeopathy in recent times. Our deepest gratitude for taking your time and being with us. Thank you, sir.
Thank you very much.
Thank you, sir.
Thank you, sir. Thank you, sir.
Thank you very much. Thank you, Gokul.
Thank you, sir. Thank you.